Hi, I am Khoi, and this is the video about professional profile for mental health nursing. During the course, I learned a lot about interpersonal skill. As we all know, communication is the key for treatment in mental health cases. It's really helpful for counseling patient, for moving the treatment forward, and for screening the disease. Before, it's really hard for me to tell the differences between a bad day and a mental problem. So now it's much better as I already know the risk factors of many different mental disease. One topic which is really standing out for me is transference. Transference doesn't only happen to your patient, but it can also happen to nurses. For example, if you treat a patient like your mother when she's obviously not, then you are having a transference feeling. At least that is the positive one, but it can also cause negative feeling. For example, if you see someone look like a person you didn't like, you might treat that patient badly, and that is a negative transference, and a small negative feeling like that can fail the whole session. So when you see that coming, you need to talk either directly to your patient or to your colleague to find out the solution. You may also should consider changing the nurse for that patient. And For me, to be a good mental health nurse, the most important thing is to be a good listener and to have empathy to your patient. um, because a person with a mental problem cannot express themselves normally. So if we can just be there to listen to them and to have them express themselves fully and wholly, uh, it can fast forward the pace of the whole treatment. In the last 3 weeks, I decided to shift my focus into studying about specific mental illnesses and how to treat them. Of course, I couldn't cover them all, but at least with the help of pharmacology and a book named Foundations of Psychiatric Mental Health Nursing, a clinical approach, I did went through most of the popular mental illnesses out there, and most of the typical processes and medicine we use for mental illness. Uh, I'm really surprised about how widely mental illness has been recognized in Western countries, but it really concerns me also about how seriously this person has become. So, as nurses, I think it's really important for us to put mental well-being of our patient in priority, and it's important for us to know and to learn much more about mental illnesses. Thank you for listening.